Medicare has exactly one decision that you mostly can't take back, and it happens in your first 6 months. Almost nobody explains it that way. So people make a quick choice at 65, find out the consequences at 72, and discover the door closed years earlier. Today, the Medigap window, what it is, why it only comes once, and how to think about the choice it forces. General education as always, rules from Medicare's own published materials, sources on screen. And because state rules genuinely vary on this one, keep your state in mind and verify the specifics. First, 30 seconds of map because Medicare's parts confuse everyone. Original Medicare is parts A and B run by the government. It covers a lot, but it has no yearly cap on what you can owe out of pocket. To handle that gap, people generally pick one of two roads. Road 1, a Medigap supplement, a private policy that rides alongside original Medicare and pays most of what Medicare doesn't. Higher monthly premium, very predictable costs, and with original Medicare, you can see almost any doctor in the country who takes Medicare. No networks and effectively no referrals. Road 2, Medicare Advantage, where a private plan replaces how you receive your Medicare. Premiums are often low or zero. Many plans bundle drug coverage and extras like dental allowances. But you live inside a network, you may need prior approvals, and you pay as you go, up to a yearly out-of-pocket cap that can run into thousands. Neither road is wrong. People thrive on both. The trap isn't the choice. The trap is that the doors don't swing both ways. Here's the rule that makes this video matter. When you're 65 or older and enroll in Part B, a clock starts, 6 months. During those 6 months, federal law says insurers must sell you any Medigap policy they offer. No health questions that can be used against you, no denials, no surcharges for your conditions. Heart history, diabetes, cancer survivor, doesn't matter. They must take you. When the window closes, in most states, that protection ends. Apply for Medigap later, and the insurer can ask health questions, charge you more, or simply refuse. Permanently. That's the asymmetry. Advantage will generally take you back every year. Medigap after the window can say no for the rest of your life. So the real question at 65 isn't which plan looks best this year. It's, do I want to keep the Medigap door open while it's guaranteed? That framing changes decisions. Now the safety valves, because there are two, and they're worth knowing exactly. Valve 1, the trial right. If you joined a Medicare Advantage plan when you were first eligible at 65, you get 12 months to change your mind. Leave Advantage inside that first year, and you have a guaranteed right to buy a Medigap policy. No health questions. It's a one-time test drive. The day that first year ends, the trial right ends with it. Valve 2, the annual windows, which everyone confuses. So here they are cleanly. October 15th to December 7 is the fall open enrollment. You can switch Advantage plans or move between Advantage and Original Medicare. January 1st to March 31 is the Advantage-only window. People already in an Advantage plan get one switch or can drop to Original Medicare. But, and this is the part the commercials never say, those windows give you the right to leave Advantage. They do not give you the right to buy Medigap without underwriting. You can walk out of Advantage every fall. Whether a Medigap insurer must accept you is a separate question. And in most states, after your 6 months, the answer is they don't have to. A few states soften this with their own rules, some with annual or birthday month guaranteed windows. That's worth one search or one call for your state because it changes the math. So how do you actually decide at 65? 3 honest questions. 1, if my health changed badly, would I want any doctor access? Things like out-of-state specialists in major centers without network permission? If yes, that leans Medigap, locked in while it's guaranteed. 2, can my budget handle a steady premium now in exchange for fewer surprises later? 3, am I disciplined enough to use the 12-month trial right if I start with Advantage and don't love it? Starting with Advantage isn't a mistake. Starting with it and sleepwalking past month 12 is how people get stuck. And if you're helping a parent or spouse turn 65, this is the single most useful thing you can put on their calendar. The Part B start date plus 6 months, marked as Medigap window closes. One free resource before the recap, because this decision deserves a human. Every state runs a ship. the State Health Insurance Assistance Program, with trained counselors who don't sell anything. They'll sit with you and compare. It costs nothing. And they're exactly who this fine print was written for. 1-minute recap. At 65, Part B starts a 6-month window where Medigap must accept you, conditions and all. After it closes, most states allow health screening, and the answer can be no forever. Advantage is easy to join every year. Medigap is only easy once. First-time Advantage joiners get a 12-month trial right back to Medigap. The fall window, October 15th to December 7th. And the winter Advantage window lets you move plans, but they don't reopen the Medigap door. Decide at 65 with the door in mind. Not just this year's premium. Next time on What You're Owed, the 4 federal programs that pay Medicare costs for people on modest incomes, including one that refunds the full Part B premium, worth over $2,400 a year, to millions who qualify and never apply. See you there in them.